Hello and welcome to Your South Florida. I'm Arlene Borenstein. Mental health affects all of us, and our needs can look very different depending on where we are in life. From young adults facing pressure to find their place in the world, to midlife adults balancing careers, family, and personal change, to older adults navigating loss, retirement, and identity. The mental health journey is never one size fits all. On today's program, we're taking a closer look at mental wellness through life's different stages and the local resources helping people feel seen, supported, and understood. We're starting with midlife, a time that can bring major transitions, often silently. To help us understand the unique mental health challenges facing women in this stage and how to better support them, we're joined by two experts. Catherine Murphy, CEO of NAMI Palm Beach County, and Sherry Warner, a licensed marriage and family therapist and founder of Serendipity Women's Mental Wellness Center. Thank you both for being here.
Thanks so much for having us.
Thanks for having us.
Of course. Catherine, we'll start with you. You deal with mental health challenges across all age groups. Tell us what that looks like. As we said, it's never one size fits all.
So we serve people generally 18 and up, but a wide range of conditions and different life experiences. All of our programs are peer-led by people who understand what it's like to go through similar challenges. We have support groups, classes, education, different presentations, just to try to reach people where they're at across the lifespan. So if we're looking at middle age, we offer a lot of programs for people in that age range, including the support groups, wellness programs. We have an incredible resilience training program, just a lot of different options for various people on different stages in that journey.
And Sherry, your center focuses exclusively on women's challenges in midlife. What inspired you to do that? And tell us a little bit more.
Well, our center actually works a lot with women and adolescent girls and teens as well. But our focus on women's challenges through midlife kind of came as a result of my own experience and being forced into surgical menopause and not understanding what I was facing. And that led to me asking questions about how other women are experiencing the same things, and if I had questions, how many other women had questions as well. And so we decided to put together programs and events that would focus on situations that women experience during midlife, first and foremost being menopause, the symptoms, experiences, behaviors, and the impact on their family.
Catherine, I know that you also deal a lot with caregivers, women who are going through these things, and they have a whole other set of responsibilities. There's even a stigma around, this time of life, but imagine also having to care for another human being. So how do you approach that?
This is a majority of the people that we serve is caregivers, and you might call it the sandwich generation, where you're taking care of potentially your kids or even your adult kids, and then also your aging parents. And so a lot of the people come to us, they feel alone in what they're going through because they're caring for their family on both sides of that. And then they might also not feel that same support any longer. They might not be able to talk about what they're going through at work with their colleagues. They might be, trying to live up to, a certain presentation in their community and might not feel comfortable about the challenges that they're going through. And so we try to offer a place where people can come and just be authentic and share about the different experiences that they're having with other people who really get it.
Wow. I bet the heaviness of that can often propel like anxiety, depression. They come in wanting help, not just for them, but also because they're caring for others. How does your organization help deal with that?
We have a support group every Wednesday night for the family caregivers of somebody living with a mental health condition. That support group's free. It's very easy to connect with. You just go to our website and you can sign up and really get that support right away. And it's other family caregivers who understand what that experience is like. They understand the stigma. They understand the isolation. A lot of times there can be shame or privacy or secrecy or even just not knowing how to talk to somebody. But what it seems to happen is that once individuals start to talk about what they're going through, they realize, wow, you're going through that too. And the more that you talk about it, the more you find out that everybody's going through something and it's okay to talk about it.
You're not alone.
You're not alone.
Definitely. Wow. Sherry, your Serendipity Women's Mental Health Wellness Center, I think I got that right. What services do you provide in that same sense and also dealing with women in midlife that can help?
We currently offer primarily individual services, so groups are wonderful, support groups are wonderful, there's unity in numbers, but there are a lot of women who are feeling that sense of shame and they are not quite comfortable speaking up about some of the things that they're experiencing in a group setting. So we offer that one-to-one individual space that is theirs and theirs alone. They're not at home with the family. They're not sharing with others. They come into a space that they have set where they feel like this is my space for the 45 minutes or an hour, and I don't have to think about anyone else but me, and I can say whatever it is I want to say. I can say how I want to say it, or I can sit and say nothing because this is my space and my time, and this is a place for me to feel heard.
Something you mentioned is shame, and how do you deal with this? You know, how do different generations of women going through these different things approach that? You know, that some things are just more taboo for certain generations than others. How do you guys look at that and help them through in different ways?
I think it's different based on who you are and your upbringing, your background, the environment in which you were raised. We are all taught shame based on our culture. Culture being family, culture being ethnicity, culture being region. And so what may be taboo or shameful for one may not be taboo or shameful for another. I like to work with women and go back to the source of the shame. What was it that transpired back in your childhood or your teenage years that made you feel that this particular issue was something to be shameful about? How has that impacted your life throughout? How is it continuing to impact your life today? Let's work through that to help you overcome shame so that you can continue to live the life that you want to live, how you want to live it, you know, helping you become your best self, helping you heal.
How has NAMI Palm Beach County been seeing these numbers? Are more women coming in for this type of support? What have you seen so far?
In general, we're seeing great increases in the amount of people who are seeking help, be that therapy or support groups, telehealth. There's a lot of increased access, increased awareness, and destigmatizing around help seeking. We also see a lot of women who are the ones who are reaching out for help and support. So we've definitely seen our numbers increase in the last couple of years. During the COVID era, we saw a lot of people reaching out for the first time, and I think we've really seen that continue. People who maybe they weren't comfortable reaching out for help and support in the past. I think that so much has been done to help people feel like it is not your fault. It's not a weakness of character. It's, you know, nothing that you've done to bring you to this place, but it's okay to go and get support and to reach out for help for it.
And there are peer-led programs where you have maybe women helping other women as well to make it feel a little more normal.
Absolutely. We have one group that's specifically for the more mature ladies. They meet every other week and they have lunch and they socialize and they talk about the experiences that they have being mature women and how that's a bit unique.
Sherry, you know, you are an attorney.
I am.
And so how does that help you with your therapist, you know, career and that end of the industry where people are coming to you with, you know, maybe emotional life changes, but yet you can bring in this other knowledge you have to help with barriers people are facing. Tell us about that.
It has helped, especially with the women in the nonprofit at the center who are experiencing some sort of depression or anxiety symptoms as a result of maybe a legal issue that they're facing. So we've had women through the lifespan, whether they're young women in their 20s going all the way up, who are having anxiety or depression or just feeling dysregulated because they're going through a divorce, child custody issue, maybe a DUI, shoplifting, whatever it is that they've gone through and they don't understand the legal process. And so my background in law kind of helps to placate them a little bit in terms of being able to give some clarity to them about what the process is like for them and how they can navigate the process. The more information they have, the less anxiety they have. Once we reduce the anxiety, then we can help them by working with them through whatever other issues they're experiencing. So that's where my legal background has come in. Also on the administrative side, being a lawyer, I've worked in different areas of the law as a litigator. I've worked as a transactional attorney, real estate, and so all of that background comes together in building the organization so that it's solid and it can do what it needs to do for the women who come to us.
Catherine, there are women who are silently struggling. What would be your message to them? Where would be the best way to take their first step and how to take that first step? How would you encourage them?
Well, an incredible resource that we have is the 988 helpline. So 24 hours a day, wherever you are, you can call 988 from anywhere in the country and get connected to immediate support. And whether you're in Palm Beach County, you're in another county in Florida, or you're anywhere in the country, you can call that number and get help right away, and then they can connect you to local resources. With NAMI, we're a national organization. There's over 600 NAMIs throughout the country, so it's very easy to get connected to a local NAMI, and then we can help people to navigate to appropriate resources. And it may or may not be something that we offer at our NAMI. It might be referring to a local partner, helping people to find the right type of treatment or right type of resource for them.
Wow, thank you so much. And Sherry, what about you? How would you encourage women to take the first step to get help?
Call us at Serendipity. We are available and we're here to help you. And the fact that you're picking up the phone and making that call tells us that you have reached that point where you're tired of being tired and you're ready for help, and we're here to help.
Thank you guys so much for being here and encouraging women to just step forward, right, and get the help they need. Catherine, Sherry, thank you so much.
Thank you, Arlene.
While mental health awareness has grown in recent years, many young adults, especially those in college, still struggle to find affordable, accessible support. One South Florida nonprofit is working to change that, though. Beyond Gray, founded by Bianca Natali, provides free mental health services and community programs tailored to college-aged young adults. Inspired by her own struggles with mental health, Bianca set out to create the kind of support she wished she had. We spoke with her to learn more about her journey and how Beyond Gray is helping young people feel seen, heard, and supported.
I started Beyond Gray right in the midst of the pandemic. I was doing a lot of mental and physical health care practices that were really helping me, get out of feelings of anxiety and depression. And I started the platform really to share ways that mental and physical health was helping me. It later grew into creating programs for recipients here in South Florida. And we have a therapy program that's curated for college students to receive one-on-one therapy. And we also have a half marathon sponsorship program to run your first half marathon. If you're a college student, you're enrolled in a South Florida college, you can go straight to our website to apply for our program. And if you don't have access to mental health care, we will connect you to one of our therapists in network, and you'll receive 9 sessions with a therapist to use within 90 days. And then from there, after your 90-day program, we also offer group therapy. We act as, your beneficiary. We cover the costs with our therapists. A lot of the times, we're working with students that are not very familiar with mental health, which is also one of the reasons why we started Beyond Gray. For me, I didn't know what mental health really was until I had no other option. So really, our goal is to create this awareness around mental health before it's essentially too late. When we're looking for a community partner, our main focus is, first of all, noticing what separates them from the others. Here at Open Door Yoga, we really focus on creating a safe space for everyone that walks through the door. And for Beyond Gray, that's the most important thing, to make sure everyone feels safe and welcome for them to, heal and to connect and to, process their emotions and their feelings. When we're looking for a new therapist, we like to check and see also what differentiates them. So for example, one of our therapists, Carolina, she works through somatic healing, and she also does art therapy.
I think while mental health is something that is so important, it's unfortunately something that can be challenging to get access to, whether that be because of pricing, whether that be insurance, whether that be cultural factors of people not really understanding what the experience is. And so when Bianca from Beyond Gray came to me with this idea for this program to provide free therapy for college students, I thought it was just such a great idea, because That time in college is such a formative time for all of us. It's when we tend to really focus on finding ourselves, on figuring out who we are, what we want to be. And that can be challenging when we have experiences from our past that we're still holding on to. The way that I like to describe art therapy, it's that the use of art making and the creative process, so anything in the visual arts related to drawing, painting, coloring, collage, etc., really helps to enhance the client's experience in their process of healing. Somatic healing is a mindfulness-based practice that allows for us to come into our physical bodies, to understand its sensations, its experiences, and its memories. Generally speaking, we always start the practice with finding a sense of safety within the body, feeling grounded, really knowing where we are in that time and place. And then from there, we shift into some exploration, right? So what are the sensations that are coming up in the body, starting to get curious about what some of those can mean, and then really listening to the desires of those experiences, right? So what does that sensation want? How does it want to move? What does it want to say? To really bring that sense of clarity, and over time using that for tools to then help us keep using it in everyday life.
The first workshop we ever hosted and the introduction to our therapy program was with Carolina, and she hosted a art therapy workshop. It was a group therapy event called Create Color. We were able to, connect to color pencils and markers and pastels, and we started by doing a somatic healing meditation to get into our bodies. And then from there, we colored with the markers, the color pencils, and the pastels, sort of like how we were feeling. And then as a group, we were each able to explain, a little bit more about our drawing.
Everyone had their own journals. There was art materials spread out throughout the table. And I just started us all with a mindfulness practice. So really coming into the body, noticing where we were, what we were feeling in that moment. And then from there, coming up with images, visualizations through that practice that then the students were able to draw, create within their journals. It was so beautiful to see the students really open up about their experience, things that they were noticing that they hadn't really thought about in a while. Really finding a way to connect with the art material, with each other, with themselves, was just something really special to experience.
I've had people come to their first day or one of their first workshops that they're attending, and they've told me things like, oh, it was a lot for me to show up here, but I'm so happy I showed up today because I'm feeling so much better. And then I've seen them to continue showing up for themselves. Now there's some students that are looking into becoming yoga instructors and also bringing their friends along with them. So by showing up for yourself, you're also guiding the way for someone else. A line that's always helped me is, right now is not later. So if you're feeling something right now in this moment, just know that you're not going to be feeling this in a few hours, a few days, a few weeks, a few months. There's always a different lining. There's always a beyond gray.
Mental health challenges don't discriminate by age, but the support we need can look different at every stage in life. Whether it's teens struggling with anxiety, young adults facing life transitions, midlife adults managing stress and burnout, or older adults coping with loss and loneliness, access to care is essential. The Falk Center for Counseling in Palm Beach County provides free and low-cost mental health services for people of all ages. Joining me now to talk about these resources and the unique needs that arise across life's different stages is Dr. Holly Katz, Clinical and Training Director at the Falk Center. Dr. Katz, thank you for being here.
Thank you so much for inviting me.
Of course. Tell us a little bit more about the Falk Center.
Well, the Falk Center for Counseling was initially founded by Elizabeth Falk. She was actually the first woman to get a PhD in psychology from the University of Florida. And her belief was that everybody should receive quality mental health services regardless of an inability to pay. So our agency is a more than 50-year-old not-for-profit agency serving children through older adults, everything in between, serving those individuals in a variety of mental health programs.
One of your core missions is to provide free or accessible care. Tell us about some of those services.
Well, we provide counseling groups either on telehealth or in person, and our group counseling is either free of charge or very low cost. And when I mean low cost, I mean like $5 a session. So that's amazing, so that anybody can receive services. We also do individual therapy and family therapy and couple therapy, and those services are $65 a session, but anybody has an opportunity to request a reduction in fees, and we provide those based on their level of income.
You work with age groups, and it could be teens, midlife, older folks, like we were saying. Let's start off with teens, though. What are some of the biggest challenges they're facing?
Well, I'm sure you know, today social media has really done damage to that population because people are looking at other individuals and basing their lives on what they see others are showing their best selves or their fake selves. And so that level of competitiveness and feeling like maybe I'm not good enough is something that is very, very damaging to teenagers. And what we know is we've seen over the last decade a huge rise in mental health challenges for teenagers. Depression and anxiety is now 20% of the teenage population.
Wow.
And in the age group of 10 to 24-year-olds, suicide is the second leading cause of death, which is just not acceptable today.
Oh my gosh, I feel like the next follow-up should be, what do you do? How do you encourage them? And as a parent, what do you look out for?
Right. So one of the things that you want to really do is create an open conversation for your teenagers and not be afraid to discuss with them that sometimes talking to a mental health professional is a very, very brave thing to do. And it would be a shame for anybody to not receive services because today we know that mental health challenges are absolutely treatable. So we have programs that bring teenagers together who have challenges with coping or challenges connecting with other teenagers. So for example, in our COPE group, teenagers are going to learn skills for emotion regulation, problem solving, any kinds of skills that are going to help them to deal with very, very uncomfortable feelings. And in our Connect groups, we teach individuals how to make friends, how to keep friends, how to have appropriate boundaries, and those skills really set teenagers up for future success.
Right. Challenges evolve as we get older, and folks coming to you in their 40s or 50s, what are you seeing in that age group, and how are you helping them?
So one of the challenges, particularly in midlife, is the challenge of, for many people, caring for an older adult parent and also a child, and we call that the sandwich generation. So you're really feeling like you're divided, your attentions are divided between caring for your parent and caring for your child, and really having very little self-care.
Right.
The other challenge that we see very often in midlife is that people are starting to think, how much time do I have left? Have I had the career that I want? Do I have the relationship that I want? Also, physical changes start to happen, and there's a concern, for women, for example, you're reaching menopause, medical challenges and changes, and that can be also really stressful during that time period.
And seniors and older adults, what's impacting them right now, and how do you support that population?
So older adults, one aspect that we know, loneliness is very, very highly tied and connected to depression, and individuals who are lonely and depressed actually have a much higher rate of mortality, so you actually can die of loneliness. One of the aspects that we do, one of the programs that we do, we actually have two very large programs for older adults to increase their social connectedness. One is we go out into the community and we provide on-site support groups to older adults in residences, in senior daycare centers, in assisted living facilities, and we provide these support groups so that individuals can see, oh, I'm not the only one, and they have an opportunity to tell their story, reminisce on their life, and really receive the connection and validation that they deserve. We also have another program which is absolutely wonderful. during COVID, as you remember, the whole world got shut down, and so our support groups out in the community for seniors, we weren't able to reach those people. So we developed a program where our clinicians in training would go ahead and call the senior adult once a week for 20 minutes, 15 to 30 minutes, and really provide that support. And all the senior needs is a telephone to be able to participate in that program. It was hugely successful during COVID, so much so that our funder decided to continue it even when we came out of COVID, because it really provided an opportunity for the older adult, wherever they were, to connect with a clinician and decrease loneliness. Very effective.
That's wonderful. And something the Fox Center also does is train clinicians. Tell us about that.
Yeah, so one of the things I always say to somebody, and I have a friend who's a very, very successful doctor, and he says one of the things you want to do is if you go to a new place or you're living in a new place, which hospital should I go to? Always go to the teaching hospital, because they're the ones that are going to have the state-of-the-art treatment, the latest evidence-based treatments. For psychology, it's very comparable. So we take students from across the nation through our American Psychological Association approved internship, and students here from our local universities. So we have students who train with us from Lynn University, Florida Atlantic University, Nova Southeastern, and from all over the country as well. And those students receive very, very close supervision and didactics, and this program allows us to provide services at reduced fees, so that any individual who comes for services at the Fox Center is going to pay a fraction of what they would pay a private practitioner. And they're also getting the utmost, the latest of care, latest evidence-based treatments, and a lot of brains around the table to decide on what the best treatment is for that person. It's a very individualized plan, and we spend a lot of time and energy figuring out and tailoring the specific treatment to that individual.
No matter what age you are, let's just say 16 through 76, how would you encourage someone to take that first step and not be afraid to come in and get this great care you're talking about?
Well, first of all, it's very brave and to ask for help. Everybody needs help. Most of us at some point in our lives are going to benefit from speaking to a mental health professional. So what I say is, if you know you can get better, and we have effective treatments for all kinds of mental health conditions, why would you not go ahead and get it? And the neat thing is about the Fox Center is because we have a comprehensive mental health program for all ages, we can see a family, we can bring in the family. Maybe mom and dad need couples counseling, maybe they've kind of lost the magic. At the same time, their 7-year-old is having challenges in school, maybe listening, maybe being disruptive and needs some guidance there. And their 13-year-old is going through a depressive episode. So we can treat the entire family and really create an individualized treatment plan that makes the most sense for them.
Thank you for getting the word out on the Fox Center.
Thank you so much for having me.
Absolutely. For more on these and other resources in your community, follow us on Facebook at Your South FL. I'm Arlene Borenstein. Thank you for watching. For more stories about your South Florida community and local resources, like, subscribe, and click the video below.